The elbow is commonly referred to as the funny bone, but this nickname may de-emphasize the significance of its role in everyday life. Most movements of the arm involve the elbow joint. Humans can lift, push, reach, and do many other movements because of the hinge-like joint between the upper and lower arm. The elbow joint is comprised of three bones: the humerus, the radius, and the ulna. The distal end of the humerus articulates with the proximal ends of the radius and the ulna. Within the elbow joint and between these three bones, there are three distinct articulations. There is an articulation between the humerus and the radius, the humeroradial joint, between the humerus and the ulna, which is the humeroulnar joint, and between the radius and the ulna, also known as the proximal radioulnar joint. The humerus is the bone of the upper arm. At its distal end, it has two condyles. On the lateral side is the capitulum. The capitulum articulates with the radius, forming the humeroradial joint. The condyle on the medial side is the trochlea. It articulates with the ulna and the humeroulnar joint. Flanking the capitulum and the trochlea are epicondyles. The lateral epicondyle is adjacent to the capitulum, and the medial epicondyle is next to the trochlea. These epicondyles are important sites for the muscles of the lower arm, which will be explained soon. There are three fossae on the humerus, which are involved in the elbow joint. These fossae receive structures of the lower arm bones during flexion and extension. Above the capitulum is the radial fossa, and above the trochlea is the coronoid fossa. On the posterior side of the humerus lies the olecranon fossa. The elbow connects the bone of the upper arm to the two bones of the lower arm. The radius is the lateral bone of the lower arm. In terms of the elbow, the head of the radius is of interest. The radius head is the structure that articulates with the capitulum of the humerus and the humeroradial joint in the elbow. The head of the radius is also the portion of the radius that inserts into the radial fossa of the humerus when the forearm is flexed. The ulna is the medial bone of the lower arm. On its proximal end, the ulna has two processes that articulate with the humerus. The olecranon process is the bony part of the elbow. The olecranon process fits into the olecranon fossa of the humerus when the forearm is extended. The other process of the proximal ulna is the coronoid process. This process fits into the coronoid fossa of the humerus when the forearm is flexed. The C-shaped concavity on the proximal ulna is the trochlear notch. The trochlear notch articulates with the trochlea, forming the humeroulnar joint in the elbow. Just inferior to the trochlear notch is the radial notch. This radial notch articulates with the circumference of the head of the radius, forming the proximal radioulnar joint. The articulations between these three bones enable the elbow to be the complex hinge joint necessary for a functional arm. As a hinge joint, the elbow allows movement along one axis, flexion and extension. This movement of the elbow is provided by the humeroradial joint and the humeroulnar joint. The olecranon process of the ulna limits the range of motion of such flexion and extension. For instance, the elbow can only extend to about 180 degrees. The elbow can also rotate the radius along its longitudinal axis via the proximal radioulnar joint. This articulation allows the radius to pivot, providing supination and pronation of the palms. The movement of the elbow is not only possible because of the coordination of the three involved bones, but also with the assistance of muscles of the upper and lower arm. The triceps brachii of the posterior upper arm inserts on the olecranon process of the ulna, and it facilitates extension at the elbow. It is the prime mover in extending the forearm. Thus, the triceps brachii allows the arm to straighten. In opposition, muscles that enable elbow flexion are located on the anterior arm. The biceps brachii, brachialis, and brachioradialis are the muscles that cause flexion at the elbow. The brachialis inserts on the coronoid process of the ulna, and it is the primary flexor of the elbow. The biceps brachii and brachioradialis also aid in rotating the radius in supination and pronation. The pronator teres pronates the arm as well and assists with elbow flexion. It originates at the medial epicondyle of the humerus. Many muscles of the lower arm originate from either of the two epicondyles of the humerus. A common tendon attaches to each epicondyle, enabling the muscle attachments. Forearm muscles responsible for extension originate from the lateral epicondyle of the humerus via the common extensor tendon, the tendon that attaches to the lateral epicondyle. The muscles that attach to the common extensor tendon are the extensor carpi radialis, the extensor carpi ulnaris, and the extensor digitorum. The common flexor tendon attaches forearm muscles responsible for flexion to the medial epicondyle of the humerus. These muscles are the flexor carpi radialis, the flexor carpi ulnaris, the palmaris longus, and the pronator teres. Ligaments also attach to the epicondyles of the humerus. The medial collateral ligament, or the ulnar collateral ligament, attaches to the medial epicondyle, while the lateral collateral ligament, also known as the radial collateral ligament, attaches to the lateral epicondyle. These two ligaments help stabilize the elbow joint. The elbow is classified as a synovial joint. Thus, it is functionally diarthrotic, meaning that it is a movable joint. The mobility of the elbow was just exemplified through its ability to flex, extend, supinate, and pronate. The ends of the bones of the humerus, radius, and ulna that make up the elbow are covered in articular cartilage. As a synovial joint, the elbow joint is entirely enclosed by an articular capsule. This capsule is separated into two membranes. The outer membrane is a fibrous capsule that provides the joint with strength as it is made of dense irregular connective tissue. The inner membrane is a synovial membrane that produces fluid to lubricate the joint. In some places of the elbow, fat pads separate these two membranes. These fat pads are located in the coronoid, radial, and olecranon fossae of the humerus. Along with fat pads, the elbow joint also has bursae, as do other synovial joints. Bursae reduce friction within synovial joints as they can be found where tendons, ligaments, muscles, or bones rub together. Although bursae have a critical importance in joints, they can be problematic. When bursae become inflamed, it is classified as bursitis. The bursa in the posterior elbow is thus susceptible to swelling, leading to olecranon bursitis. Olecranon bursitis is commonly caused from the elbow resting on a desk or another hard surface, so it is also known as student's elbow. Such a condition may require needle aspiration to remove the excess fluid. The elbow is subject to other injuries as well. Tennis elbow is an injury that may come to mind. This is correctly called lateral epicondylitis. It is caused by inflammation of the tendons in the forearm muscles. Another type of elbow injury involves one of the strong ligaments that stabilize the elbow. The ulnar collateral ligament may rupture from exercises that impose outward bending forces, such as those that involve swinging a racket or throwing a ball. To repair such a rupture, an autograft replacement with a tendon from the patient's own forearm, knee, or foot is performed. This surgery is commonly known as a Tommy John surgery. The name comes from the Los Angeles Dodgers pitcher Tommy John, who was the first person to undergo this surgery in 1974. Injuries to the elbow may also involve the nerves that run down the arm and across the elbow. Such an injury is cubital tunnel syndrome, which involves the ulnar nerve. When the ulnar nerve is blocked along the elbow, it causes numbness, pain, and tingling, like the sensation felt after hitting the elbow. In cubital tunnel syndrome, though, the sensation does not go away. It can lead to permanent numbness and muscle weakness in the forearm. To treat cubital tunnel syndrome, splints may be used to prevent excessive bending of the elbow, or surgery may be performed to release the pressure on the nerve. Injuries to the elbow make it apparent how central this joint is to everyday life. When pain, tingling, or soreness hinders movement in the elbow, a person's quality of life is affected, as his or her everyday life is limited or plagued with pain. Though it may be overlooked, the elbow joint is used countless times throughout the day. as it is involved in most arm movements. Being the connection between the upper and lower arm, it is crucial for daily life, letting the arm bend and rotate throughout many activities.